Get into it, mate. Here you go.
Just take a bite. Go for it.
Big bite.
That was very
that.
graceful.
Come on, big bite.
It's not going to look good. You're taking a big bite. Okay, that's going to be on YouTube. I'm Dr Oliver Khoo. I'm an orthopaedic surgeon and I work at St Vincent's Hospital, Sydney. I'm flying to Phoenix, Arizona. I'm going to the Orthopaedic Trauma Association conference and Pelvis and Acetabulum course. The course covers complex pelvic and acetabular fractures and looks at treatment for complex polytrauma patients who have such life-threatening injuries. I'm most looking forward to the debates, which will be looking at controversies about how to treat fractures in the elderly population. Today there's a whole mix of faculty speaking. There's about 7 or 8 people, and the format is going to be cases being presented, discussions about those cases, and then a few debates about what techniques and approaches are best to fix particular fractures of the pelvis and acetabulum.
This is open and this is open and this is open.
It's always interesting to see other doctors' approaches to the same problem. It's not always the same, and there's always something to learn, especially during the debates when people have to justify why they've chosen particular techniques.
You know, if you have fixation on, they can still access.
The discussions about some really complex cases were great to see as well. It's really good to be around all these other surgeons from all around the world and exchanging ideas, finding out how they approach things, and everyone experiences very similar things, have similar cases, and it's great to learn from their experience as well, so that next time approaching a complex case it'll be that much easier. I really enjoyed Keith Mayo's talk about advice for orthopaedic trauma surgeons. It was a really heartfelt talk where he was giving great advice for how to balance work and life, which is actually really hard to do. And it was great to see his photos of his mentors and colleagues who he'd learnt from over the years, including Emile Letournel, who was the founder of pelvic surgery as we know it today. And it was really good to know that you're learning from someone who is 1 degree of separation from the person who really gave us so much for pelvic surgery as we know it. It was a great course, and it was definitely worth coming over to Phoenix, Arizona. Learned so much, and it's going to be pretty exciting to get home though, to see family and friends and get straight back into work. So I'm Dr Oliver Khoo. Thanks for joining me, and stay tuned for more.